feeling tired, low on energy, and noticing changes in your mood or drive. It might not just be aging. Your hormones could be sending you a warning signal. Today, we're diving deep into hormone therapy and testosterone replacement, what it is, how it works, and if it's right for you. Chapter 1. Understanding testosterone and its role. Testosterone is a key hormone in men, and it's not just about sex drive. It controls muscle mass, bone strength, mood, energy, and even red blood cell production. When testosterone levels drop, a condition called low T, symptoms can creep in slowly. Fatigue, weight gain, irritability, loss of motivation, and reduced libido. Chapter 2. Causes of low testosterone. Low T can happen due to natural aging, chronic illnesses like diabetes, obesity, or sleep apnea. It can also result from certain medications, injury to the testes, or pituitary gland problems. Before starting treatment, doctors always run blood tests to confirm the cause and measure hormone levels. Chapter 3. What is hormone therapy? Hormone therapy for men typically means testosterone replacement therapy, TRS. T. The goal: restore testosterone to a healthy range and relieve symptoms. TRT comes in different forms: injections, given weekly or bi-weekly; gels, creams, applied daily to the skin; patches, worn on the skin, releasing testosterone slowly; pellets, implanted under the skin for long-lasting effects. Chapter 4. Benefits of testosterone replacement. When done correctly and monitored, TRT can improve mood and mental focus, boost muscle strength and reduce fat, increase libido and sexual performance, improve bone density and overall vitality. Chapter 5. Risks and side effects. Like any treatment, TRT has risks: acne or oily skin, fluid retention, sleep apnea worsening, increased red blood cell count, possible impact on fertility. That's why doctor supervision is essential, with regular blood checks to keep therapy safe. Chapter 6. Who should and shouldn't use TRT? TRT isn't for everyone. It's usually for men with confirmed low testosterone and symptoms affecting quality of life. Men with prostate or breast cancer, untreated sleep apnea, or high red blood cell counts may be advised against it. Chapter 7. Lifestyle and natural boosts. Even with TRT, lifestyle matters. Strength training, enough sleep, reducing stress, healthy weight management. Sometimes these steps alone can improve testosterone levels naturally. Hormone therapy and testosterone replacement can be life-changing, but only when done safely and for the right reasons. If you think you have low T, don't self-medicate. Get tested, talk to your doctor, and make the choice that's right for your health.